Okay.
All right.
Okay.
Ready?
Yeah, I got it on.
Perfect. All right. So basically, anytime that we have surgery, particularly this kind of surgery, we're going to have a lot of swelling. So with that in mind, there's going to be a few things that we're going to be wanting him to do over the next couple weeks. And even when he's getting therapy, we'll continue with him wanting to do some of these precautions.
Okay.
Basically, like I said, swelling is common with the surgery, but he's going to have probably a decent amount of swelling, so we want him to be elevating as much as possible. So really we want him to have his arm above heart level, and I've got some instructions here for him.
Okay.
Like I said, basically just have it above heart level, no real trick to it. If he wears a sling home tonight, just make sure he stays in the sling until the numbness wears off. We just don't want him bumping it on the way out, or if he takes, falls asleep tonight, he doesn't have his arm back behind his back. So we just want him to wear the sling till the numbness wears off. We talked about the swelling. He didn't have to walk around with his arm up in the air for the next, 2 weeks, but we just don't want his arm down at his side for prolonged periods of time. Swelling tends to follow gravity, and so if we have it down at his side, it's just going to be hard to get the swelling out of the fingers.
Okay.
Okay. Now this is a hard dressing, so the back side here is a hard dressing, and so it's going to be difficult for him to, if he uses ice, it's going to be difficult for that ice to penetrate. So with that in mind, he can either put it somewhere maybe just proximal to where the dressing starts, or he can put it on the other side. But the operation was done on the back side of the wrist, so it probably won't give him much relief. So really, I would encourage him just to put it somewhere through here. The dressing itself will stay in place until he comes back to see the doctor, or until hand therapy works with him. So he'll keep that dressing just the way it is until he comes back. What's that?
He always takes it off.
Oh, well.
I'm just telling you.
Mr. Bruce, do not take off your dressing, okay? We want you to keep that dressing in place. I know he's pretty worn out, looks like.
Yeah.
He won't remember me, but like I said,
Yeah,
show
but
him this
see,
video.
this will help instead of me telling them, because I won't
Absolutely.
remember every detail. That's good.
Absolutely. So like we talked about ice, as far as keeping it dry goes, I've got some umbrella bags here for him. And so like we talked about, keeping it dry, keeping it on, and keeping it clean. So I'll go ahead and pass these to you. These are just umbrella bags for showers.
Okay.
Probably would not take a shower maybe until tomorrow, particularly if he doesn't have much control of his arm. Getting into the shower with a sling on is going to be a pain in the neck. So
Yeah.
we just, like I said, probably let it just relax for now.
It's not going to be that hard since we have an outdoor shower
Oh, okay.
without any walls.
Perfect. Well, that
So,
shouldn't be
yeah.
shouldn't be much of an issue then.
Right.
That's good to hear. Now his fingers. Let's just see. I'm just gonna look at something real quick, Mr. Bruce. Just want to see if your fingers can move in here. I don't think they're going to be able to. If he can move his fingers, I would encourage him to be moving his fingers as much as possible. Mainly, for one, it prevents stiffness, which he's probably already pretty stiff.
Yeah.
As well as trying to help pump some of the fluid out. So I don't think he's going to be able to move his fingers very easily in what he's in now. But once he comes out, we want him to be moving his fingers as much as possible. But for now, he can't be moving his thumb. So once that numbness wears off, we want him moving his thumb clockwise, counterclockwise, and then touching each finger. So coming to touch each finger, that sort of thing.
Okay.
Okay, so keep the thumb active. And like I said, if he can move the other fingers, he can. But I understand if the
It's been hard for him to do it in the past.
Yeah. Well, like you said, particularly with him and having adhesions, it's gonna be sore. It's gonna be painful.
Yeah.
But in order to get full motion back or as much as we can,
Yeah.
we want to move it early. And so I'm gonna get one of our
I'll tell him.
PAs to write us up a script for you so that you can get it filled out there. And do you have anybody that you know of that does hand therapy there? I can get you a list.
Yeah. You mean in Tallahassee? Yeah. And Quincy. I mean, there's some.
Oh, there's some in Quincy.
There's some rehabilitation therapy offices, but
Well, let me. What's your zip code?
32351.
32351. All right. Let me. I've got a little website that I can find certified hand therapist in your area.
Okay.
So I'll go take a look there. And then I'll bring back that order as well.
Okay.
So we'll try and get that
All
order
right.
for you so he can get in some therapy
All right.
tomorrow.
Thank you.
All right.